Well, I think it's important to first highlight that the World Health Organization did put forward a lab incident as one of four potential causes. So, not totally within the realms of conspiracy theories. This was pursued as a potential reason for the current pandemic. And unfortunately, that one research trip with the international community team and the WHO, they're not there. They decided a little while ago, perhaps this is not the most likely theory, still sticking to the zoonotic origin as a more likely theory. However, at the same time, the WHO has said we're going to need to conduct further studies. It wasn't a case closed scenario. It was unfortunate, however, that WHO was not granted access until a year into the pandemic. So that certainly did hamper understanding of how that originally began. And I would also like to highlight that the WHO did call for those investigations to begin as soon as the international health regulation did come forth. So I think that this is going to be a long road ahead. The WHO is committed towards investigations, but it is also diplomatically, politically a landmine. We have to have the cooperation of Beijing on board to get access to that information. But equally, just bulldozing through, which some of the people are currently accusing the US of doing, is a bit let's say counterproductive.
It is indeed, and it sort of suggests that there is something to hide. Now, of course, some rather solid in-depth reporting done in just recent days and weeks has suggested that there were workers who fell seriously ill, Wuhan lab workers that fell seriously ill at the time of this virus spreading. Intelligence agencies have been ordered to report into this. Really, what can they uncover?
Well, those individuals within the lab who did develop COVID-19 like symptoms, which can be similar to other types of respiratory diseases, I think it's going to be very difficult to track down those lab samples to definitively confirm that this was indeed SARS-CoV-2 virus rather than another respiratory illness. So I think that equally, given the timeline in which we see the frontline workers, the healthcare workers who did try to whistleblow originally, who did try to warn the world, and again, the Chinese government tried to manage that internally, tried to see if they could ramp down those cases before sounding the alarm, and that proved to be a very significant error, and one that they have repeated historically. If we look back to 2003 with SARS, it was a similar lack of transparency in those early moments where there was a prioritization around really internal control rather than sounding the alarm. And I think right now we see the World Health Assembly is meeting in Geneva. This is the political WHO forum where it is the most significant when we look at the times of the year. I'd say historically this is the most important ever, because last year we didn't have vaccines at the time of this assembly coming together. So you will see that the US and others will be putting a lot of pressure on trying to get these answers. So I think that, again, the WHO is going to be a big theme. But I also, alongside, of course, it's going to be very important to try to better understand the origins to prevent future pandemics. What we also have to realize now is that the acute phase of the pandemic is not over. And really, we need to be ensuring that things like ensuring low-income countries are getting the vaccines that they need, that we ramp up manufacturing is critical, because without that, we're just in this loop of vaccine versus variant with no end. So as important as this is, and as I'm not convinced that we will get definitive answers at any point in the future unless there is a whistleblower or a regime change.
And Oksana, would there have been a legitimate reason for experimentation with a virus like this happening in a lab?
Well, viruses are used within the lab for a variety of different reasons. So we do see that, again, this is being one of the most highest security type of labs in the region. I think that's also why when we look at the suspected bat species that's linked to it, it's actually not within that area. There are many reasons that we are looking at understanding different viruses. And part of that is also just around developing medicines. And there are other, of course, aspects that are more sinister in which we look at biological warfare as well. But on the whole, that there is a very important foundation of understanding science. And in order for us to have, let's say, advancement in health, this sometimes does mean that we're working with these types of viral vectors as a way into the body. So it's not necessarily for something that is of a negative reason, but certainly we do see it's common, not just in China, but in the US and many other countries.
Interesting, really fascinating. Thanks, Oksana.
Thank you so much.